Okay, my name is Sean Glassberg, and I'm Director of Faculty Development. Today I'm going to play the role of an adjunct nursing instructor only on the clinic sites. And Lori Jackson will introduce herself.
Hi, I'm Lori Jackson. I'm the Assistant Academic Chair of Nursing and Nursing Professor here at Horry Georgetown Tech, and we need to go over the clinical evaluation tool. So Sean has graciously agreed to serve in that role so we can make sure that all adjuncts are getting this filled out correctly.
Okay, awesome. Happy to play that role. I'm sure I'm going to learn a lot about what to do and what not to do on these important forms. So the first place I believe we'll start is making sure that we put down the student name. So we'll use a student here. We'll call her Jane Jackson. And the semester.
That's my sister.
Oh, really? Do you have a sister named Jane?
I'm just kidding.
All right. Well, last time we used Jane Glassberg, so I figured I'd use Jane Jackson this time, especially with the mistakes that Jane Jackson is about to make. So semester we'll put down fall just to make it, make one up, and we'll put 2011. And I think last time when we filled one of these out in a little meeting between ourselves, Lori, you told me what an agency might be, what a unit might be. So I think we use what?
Yeah, we can put Conway Medical Center. Conway Medical Center.
All right. And then the unit?
2 surgical.
Put down 2 surgical. Okay. And so, Lori, most people get this correct, right? As a clinical instructor, they fill this out pretty much to the T.
Yeah, this is usually done correctly.
Okay. So we roll through, and we look at the different sections here. And we don't need to go over that now because that's pretty much not where some of the common mistakes are made.
Exactly.
I think we were working on this page when we met, and let's go ahead and explain here what we have in front of us.
We have a clinical performance evaluation tool, and it is designated per weeks, as you can see at the top, week 1 through 14, which is about the number of weeks that they will spend either in lab or in the clinical setting with us as clinical instructors. The first 3 weeks are usually labs. For some courses, it may only be 1 week or 2 weeks that they have as designated labs, and the rest of the time would be designated for clinical. So as you can see, Sean was highlighting the labs as week 1, 2, and 3, and then the remainder of the weeks would be the weeks that you as an adjunct for us would fill out in the clinical setting. And underneath the actual number you would place the date and the location would be whatever unit you're on. Or if a student goes off the unit to some place such as one-day surgery, or they go to the OR or something like that, you would designate it according to where they are.
Okay.
So Sean's going to fill out some information for us.
Or 2 surgical, right?
Yeah.
Okay.
That's fine.
Okay. So we do that for each one. And I think Lori mentioned last time, too, that these are done, mostly via pen or pencil. We're not doing this by typing. Okay, good. Now, the problems that I remembered, if I remember correctly, occur when an instructor might put down a grade, we'll call it, right? Would you call it a grade?
Yeah, it's a grade.
A grade. And those grades are found, where are those? There they are, right here.
Yep, there they are.
You could do an S, a U, or an NI.
Exactly. Those are the only 3 grades that should be listed on this clinical evaluation form, but you can further quantify them, and we'll talk about that.
That's right. And so let's say Jane here gets an S in safety and an S in clinical decision making, maybe an NI in teamwork.
And then with that NI, we need to quantify that.
Okay.
We need to quantify it. If it's a behavior that is something that is simply a general teamwork and collaboration, where that they in general did not work well with other team members, and the whole category seems to be an NI, and when you look at he's scrolling, okay, the teamwork and collaboration, when you look at that, there are behaviors, and if all of those just overall seem to fit, that the student There we go. If all of the things under 3 seem like that the student just did not meet those and they all needed to be improved on, then you could simply put an NI. If there was only one behavior that the student did not do, then you would want to simply put the letter that correlates with that behavior, such as it could be an NI and then it could be 3C, which means coordinates nursing care to comply with what that statement says. So you could put NI and then 3G or 3C or whatever it is to indicate that that is the specific behavior.
Okay.
Very good.
So now I think what you were referring to when we met the other day is that sometimes you might get these forms that are completely filled out and there might be NIs but no, what would you call them again?
Further designation
Behaviors.
or quantification of the behavior.
Right.
Yes. Mm-hmm.
Okay, great. And that's,
Yeah.
so you need to see that. So the only time you would put an NI without a number or letter next to it would be if the whole category. Okay.
Mm-hmm.
Okay.
And then for the U below that, that certainly needs further quantification of what behaviors specifically, unless of course it's the whole category. And if it's the whole category, there's a problem, obviously, because a student should not have a U in all of the categories. That would be actually potentially grounds for them having counseling and then immediate dismissal if there were issues such as safety, issues like that.
Okay. So for like you see, there's a U here. So you go down to 4 here, team, that's professional behavior. So here there's a lot that's listed. I mean, it's A through Y. Kind of hard to believe that someone would actually get a U for every single behavior.
Exactly.
So we would need to, again, validate by putting in maybe 4A, if there's a problem with that, 4C, 4D.
Yes.
So we would go up to the U here, and then next to it put the correct designation.
Yes. And you can separate them with a comma or whatever, or just list them out. That's certainly fine.
Okay, great. That's
Just as long as we know. And the reason for this is that we want to make sure that these behaviors that students have, that we are tracking their progress. And if we, as each student progresses through the program, they're going to have a clinical evaluation tool for every semester. So we need to identify if there's problem areas in the same behaviors from one semester to the next. And the only way to do that is if we see these filled out correctly.
Okay, and all the behaviors are listed.
They are.
On page
There's
4
a reference.
through 5, I believe.
Yes.
Okay, great.
And actually, I think the way that it falls now is just because we offset it with the typing in there, but it would actually fall on those exact pages, yes.
So I'm going to go ahead and take out this typing here.
Okay.
So we can see what it looks like normally. Yeah, there you go.
Yeah.
Pages 4 and 5 list all the behaviors. These behaviors, again, to reiterate, need to be identified if there is an NI or a U on page 2 of the clinical performance evaluation, I guess you call it an assessment tool.
Yes.
Okay, great. So that's one thing we definitely need to get across to our instructors who are filling out this form for our students. I believe the other day as well we talked about the importance of filling out page 3 completely. Is that correct?
Yes, that is correct, because we don't want students to be surprised at midterm or even at the final evaluation. So we really need to designate at midterm as well as final exam or evaluation. I shouldn't say exam, but the evaluation of them clinically, where they are. They should not be wondering, am I going to pass clinical or not? They should know based on the behaviors that they have shown, how you have actually graded them with the S's, the U's, and the NI's, and then anything that is outstanding or appears unsatisfactory at midterm, they should be alerted to it right then.
Okay. How do we do that? If I'm an instructor, how do I do that? I mean, I could verbally tell them, but that's not what you want.
No, we actually want it documented, because as nurses we know if it wasn't documented, it wasn't done. So therefore, you would quantify that it is unsatisfactory, and you would put your initials there. You could put an X in your initials.
Okay.
Your initials indicating that you are the person that actually is giving them this unsatisfactory.
Okay.
And then what you would do is you would do a student's plan for improvement in conjunction with the student. So this could be where that you had possibly met with them and had a conference about their behaviors or about their clinical performance, and what you would do is you would indicate things that needed to be improved on. It would not be you solely, but it would be in conjunction with the student, because again, this should be no surprise to the student. This should be something that's done collectively as a plan for improvement.
So I'm required as an instructor here to put down the plan. I mean, this is in
Yes.
my writing? Okay, so the student doesn't write this. The student actually comments below it.
Right, exactly.
So do I still use some of those behavior letters and numbers, or do I this is different now?
In this area, it really needs to be a summary of those behaviors. So you could put something along the lines of student consistently unable to
What else am I typing?
perform medication. That's okay. Perform medication administration in a timely manner.
Okay. Anything else?
Constantly, yeah, just say something along the lines of constantly late in completing clinical paperwork each week. And these behaviors would be behaviors that you've already along the way obviously identified on the clinical evaluation tool. But now what you're doing is you're collectively saying this has been a problem, it's not really corrected itself, because we're using terms such as consistently and then constantly. This means that the student has not just done it once, but it has been a process over time.
And so this seems like more of a constructive criticism, or even maybe criticism. Now, when I think of the term plan for improvement, is there something else that I need to put in here that will help? Okay, what do I write next?
So this is the constructive criticism part, and then where you would want to actually give the student a plan for improvement collectively, you could ask the student prior to doing this, you could say, how do you feel that you could better be able to manage your time to complete assignments? And the plan for improvement could be that Jane will work with clinical instructor to identify early in the clinical day if on task, if she is on task or needs redirection.
Good.
And that would be a way for the student, because obviously if a student is consistently behind in their work, they obviously do not have those behaviors on their own to help them, so the clinical instructor may need to help and interject to get them back on track. Okay, so I think I remember talking about the importance also of having a student comment or reflect back on the plan for improvement. So if I have this form and really I'm not supposed to, I don't think I give this to the student and then not get it back, right? Right. I mean, you potentially could. That is why that you are going to, as an instructor, you would give it to the student, they would read through it, they would make their comment, and then they would return it to you before the end of that clinical day. Okay. We don't want them keeping the documents, because oftentimes documents get lost, and if they lose it, then anything that you've documented up to that point is going to be lost information that we cannot track. Okay. These become a part of the student's file, their permanent file. Okay. All right. That makes sense. Because I was wondering, you know, I think I need this for my own grading, and I need it back. So can I make copies for them? Let's say I have an access to a copy machine so they can keep it, or is that something I shouldn't do? You certainly should, but we really are a college. We are working on the initiative for Go Green, and I really, we prefer as a department in the Department of Nursing to not actually copy a bunch of unnecessary documents. The student certainly has access to it, but it would not be something that we would copy and just give to them randomly or in a structured manner all the time. Okay. It would be an exception to the rule. Okay. Okay. Great. Great. That clarifies something. Is there anything else that I need to do on this page other than sign it and date it? Sign and date it, and basically the student can make a comment or not make a comment. We ask that students make a comment regarding the plan for success and regarding the unsatisfactory, that they are owning those behaviors. They may disagree, and if they disagree, they have the option of actually documenting it here that they disagree with it. Doesn't necessarily change that the evaluation is what it is. We're not going to change that grade, but we're giving the student the opportunity to make comments. And if a student is disagreeing, then certainly we would need to meet with them at a higher level where the student could better understand the reason for achieving this grade.
Okay. And the same rules apply for the final evaluation as well?
Yes.
Okay, great.
And something that we need to bring note to while you're here is under number 2 of the learning outcomes, it indicates a single critical event. That could be means for dismissal from clinical based on a particular single critical event. So the student may have been going along very well, very fine up until a point, and then they have a single critical event. At that time, if this is something that is deemed as potentially dangerous or illegal or unethical, we could dismiss the student from clinical for that particular event. So that needs to be noted by all adjuncts. And if this were to occur, then any faculty member would need to contact either Christy Seminary, who's the department chair, or myself as the assistant department chair, because a single critical event is something that students have been dismissed for, but we need to document it appropriately. So that's the reason for contacting us.
Excellent. Excellent. I hope that the people who are listening to this remember that. Seems very, very, very important. Okay, so we looked at this. This is these are the performance standards that obviously, if there's a U or an NI above, we need to identify which behaviors need to be either eradicated or somehow improved upon. We talked about the faculty comments page the other day, and I'd like to learn a little bit more about that.
On the faculty comment page, we really use this for documentation or further documentation of behaviors that have been identified on the clinical evaluation tool. You can use it in a couple different ways. There's not really a right or wrong way to use this other than the fact that when you use it, you need to use it based on a date that you are doing it. And I can see that Sean's filling out some information, and what we would want to start with is always the date. So you would want to put the date at the very beginning before you start an entry, and you would then start writing regarding a student issue or something that you wanted to comment about. You can put positive behaviors here. You can put behaviors that require improvement.
Give her a positive feedback. Okay.
So you give positive feedback, and always with positive feedback, I don't like to say that we're going to give negative feedback, but lots of times, because these are students, they need some information about ways to improve. So although this student did a great job interacting with the patients and the families, perhaps she needs some improvement with actually time management. So we could say Jane needs improvement with time management. So we're giving her something she did positive, but also in another entry we're saying that she needs improvement with something, and we could quantify that by saying work with a team member on how they manage their time during the day to receive helpful pointers. Because a lot of students are able to help the other students or their peers in time management if they are doing a good job of it. And sometimes they're not as intimidated when they work with their peer as they might potentially be with the faculty member.
Great. All right. Yeah, I remember this the other day. That's a really important part of this tool. And also, I think you had said that it's important that the student sees this after the end of each or the beginning of the next clinical.
Right.
Okay, so that's right. You had mentioned the other day, give your students back give the feedback from the previous time at the beginning of your next clinical what would you call that?
The clinical day, the next clinical day, and then what they would do is they would have the opportunity to look at it throughout that clinical day when there's downtime, and at the end of the day they would be expected to return it to you, and then you would have it for the next day for the evaluation of that clinical.
Phenomenal. Now I'm going to take this stuff out of here so I don't mess up the page numbers, so so we're always looking at the same page. As I know some of your instructors might be looking at their own tool while they're watching this webinar.
Right.
So we get to the student comment page, and that was something that I thought was interesting. The student has a chance to comment on what the faculty commented on, correct? So if the faculty comment page is 6, the student comments 7, so they can respond.
They can respond. They can put information that they disagree with the above comments, and basically what we do is we read those, we take them into consideration. If there is an issue that the student has stated that is that seems derogatory towards the instructor, the individual instructor, then what we would want to do is we would want that information for Christy or I to actually meet with that student, because if sometimes there are conflicts between students and instructors, not all the time, but of course we're human and sometimes that occurs, so we would want to handle it in the right manner. So if it seems that that is the case and a student has written something here along those lines, we would need to meet with them. Otherwise, they can just say, thank you for your comments, or they can say disagree with, or they can say agree with. They don't even have to write anything.
Yeah.
It's not required that the student writes something here.
Yeah, I'm going to put that down too. It's not required, just to reiterate that. And would you say that what's the percentage of students that actually do comment on that? What do you think?
Most students don't make comments. As a matter of fact, probably only 10 to 15% of the students overall make comments on this section.
Great, great. All right, so that's page 7. We go to page 8 here, and I remember having some discussion about what to do on this page. And I remember you basically, and correct me if I'm wrong. And I'm posing as a new adjunct instructor, right, who's going to be doing some clinical supervision starting in August of 2011 here. This written test here is done in the classroom. I think is the peer evaluation done in the classroom as well?
Peer evaluation is done more in the actual lab setting, and that's something that's done on campus before starting clinical. Yes.
And then I think the first responsibility that we have as a clinical instructor, clinical supervisor, is the active participation, right? And that's where we need to do the Y or the N. Help us out here.
Yeah, you would do the Y or the N, and it should be a Y because they should not actually be participating in clinical until they've been oriented to the unit, as you can see number 3 is. But you wouldn't put just a Y, you would actually put a Y and then your initials beside it, because that would indicate who went over this particular thing with the student. Because simply a Y doesn't really tell you a whole lot about if we had a question in the future, who did this, we want to know who did it based on those initials.
Okay. Interesting. Yeah, I think you mentioned the other day that sometimes you just get the Y without initials. Okay, so you need those initials.
Yes, we need those, and probably we will revise the form to at the top say initial, please.
Okay. Okay. Anything else we need to go over on this page?
No, anything that's on there that basically relates to a clinical conference or a group meeting or a clinical setting, those would be the behaviors that actually you would be identifying as an adjunct or a clinical instructor, and you would initial those and you would put a yes that you had reviewed those.
So that would be based like 3, 6, I'm assuming 6.
Yes, 6.
I'm assuming 7.
7. 7 would be 1.
Not number 1 here.
No.
Not number 2. Number 3, yes.
3, yes, absolutely. Number 4.
Number 4, yes?
Yes, because it's a concept map. It is something that is done with the student in the clinical, and it's a paperwork that they turn in.
Great. Number 5, definitely?
Yep.
Okay, that's called the post-conference, right?
Yes.
All right, I remembered. And this obviously would be 6, definitely.
Yes.
Okay, great.
And some of those behaviors, if you'll look back at number 6, there's a whole listing of behaviors for that nursing process, and this actually could be left blank by the clinical instructor if she does not also assist with the lab, because you can see that there's some labs like simulation lab listed, so we would know that those clinical activities were all completed if we actually initialed those as the full-time instructor.
Okay.
Yeah.
That
So
sounds.
anything that pertains specifically to clinical, like it says clinical activity, it says clinical conference, those sorts of things are what you're looking for.
Okay. Yeah, I imagine I mean, as a new instructor, that might be a little bit difficult. Well, not difficult, but you might miss something if you have never done this
Right.
before.
And if you have questions, certainly you should call the primary lead instructor for that course, or you can always call Christy or I to seek clarification.
Okay. Great. Good deal. All right. So then that's page 9. Now we're on page 10. It's more of the same
Yes.
here. And then that's it.
Yes, that is it. The only thing that I want to bring up, which is a very important part, is that as a clinical instructor, we always want to provide feedback for students, whether it be feedback in a positive manner or feedback that indicates that they need improvement. One of the things that has been relatively new to us as nursing faculty is that we have really looked at our curriculum and decided that the behaviors that they have based on 101 through the 5th semester, that if we are giving them consistently S's, then we are actually doing a disservice to the students, because we're saying that you're satisfactory from the very beginning to the end. They really need to receive more NIs and more U's along the way, because that way what we're saying is you're not an expert in this area. We don't expect you to be. But if we give them an S instead of a NI or a U, we are giving them that false sense of security that they have been satisfactory. So we really need to do more of the NIs and more of the U's as appropriate.
Let me ask you a question, though. As being again as a new clinical instructor, I don't want to fail people, get them out of the program unless they really have to. So, would you advocate, using the U's only for the most severe?
Well, I mean, there are certain behaviors that U's are going to need to be given for. A huge category that needs to be given U's is if they have unsafe behaviors. Patient safety is our utmost priority as nurses, and as nursing instructors, we have to ensure the health and well-being of our patients.
Okay.
So any behaviors that are unsafe, if they are really an unsafe behavior, you need to document it as a U.
Okay.
And then if they don't improve that behavior, then that's showing a actual sequence or a pattern of behavior, and that would be problematic.
I think I have a better understanding now, Lori, and that a U here in week 5 doesn't necessarily mean they're going to make a U on the final.
Right.
Okay.
Exactly.
Okay. I want to be. I just want to make sure that one U is not going to kill them. It's just that if they get a lot of U's.
Yes, or if they consistently, let's say under number 3, you had given them an NI and it was 3C, but the next week they improved on that, so they got an S, and the following week they got an S. Then let's look at professional behavior. They got a U, and it was for 4A, 4C, and 4D.
Right.
The next week you saw that they improved and they did not get a U. They got an NI because they had improved on those behaviors, but it was still the same 3 behaviors.
Okay.
Then for a couple weeks they were satisfactory and they seemed that they really had it. Then we get out to, say, week 8, and it's like they totally have fallitis or something, and they receive the same U for the same behaviors. That would potentially be a reason for them to potentially fail.
Okay.
Because they have not demonstrated. They went from a U to an NI, then they had some weeks of S's where they seemed to grasp it, but then they just totally lost it again.
Okay.
So a U with those categories would be, we would really want to counsel them and say, we have talked to you about these behaviors in the past. You were doing better, but now you have backed off and you are back at the level you were. If we do not see an improvement by next week, then you're going to be dropped from the course as a clinical failure.
So the hope here is that discussion leads to some more S's.
Leads to the S's.
So at the end of the term, a couple of U's in professional behavior might not result in a U. It might be okay.
Exactly.
Okay, great.
And it's going to depend on the reason for the U, and it's going to depend on are they demonstrating patterns of behavior. It's just like with anything else. One event does not necessarily preclude them unless it's a critical event, but a behavior that is a behavior that they have a pattern of doing it over and over again is certainly going to make a difference in whether they fail or not.
Okay, that's great. Makes sense. Very logical. All right. Well, I think that we've or you've done some really good education for me as far as the training me how to use this tool, and I hope that that applies to the other instructors who will be watching this webinar, and they'll get a better sense of what you're expecting when they turn in this evaluation form at the end of the semester. Because that's really when you take a look at all these, right? That's at the end of the term.
Yes, it is. And then, like, say that I'm a fourth semester instructor and I wanted to see how a student had done in second and third semester. I can go pull these from their file, and what I'm going to look for is if I see a behavior in the first week and it sends up a red flag to me, I'm going to want to know, did it happen prior and what occurred with it? Was there counseling done? Is this something that potentially this student should not have even progressed forward for? Because if I'm seeing a behavior that late on, it indicates to me that there possibly was a problem earlier.
Okay. Thank you so much.
Thank you for allowing me to do this webinar with you.
Yeah, thanks for training me. And as you know, Lori, and these instructors that are viewing this webinar, there is a quiz that follows to make sure that you've understood this, and that'll be located within the Resource Center for Adjunct Faculty. Can't show where it's going to be yet because we haven't created it yet, but it'll be there for you, and that'll be required to complete this module. Thanks so much, Lori. And
Thank
we'll end
you.
it,
Have a lovely day.
Yeah, you too. Take
Okay.
care.